And this is the second fridge. This obviously has fewer items than the first fridge, which is placed right next to it. So, how would you know which item is, to be placed in which fridge? There's no such rule, but we just follow the list of the inventory that has been displayed on the door of the fridge. So items that are listed to be placed in fridge 1 go into this fridge, and the other, record the temperature of the fridge. But we also have this electronic thermometer with this little electrode inside. But sometimes there are times when it's not working properly, so we rely on this analog one, which is really accurate. So here we have Prostaglandin. Prostaglandin is Elprastodel. It comes in many other names like Caverject. This is basically prostaglandin E1, and it comes in the form of these little ampules of powder, and it's kind of a lyophilized tablet. So it has many uses. Basically, it's a very potent vasodilator, and it's used in patients, with heart problems. But I've seen a couple of prescriptions whereby, some, physicians would also prescribe this for erectile dysfunction, whereby it's, just injected directly into the corpus cavernosum of the penis, and it helps fight erectile dysfunction because of the vasodilation it provides. So Prostaglandin, this is Aclasta, this is xyladronic acid, a solution for infusion by Novartis, and it's pretty expensive again. Then we have some interferons placed here in the fridge. We have many strengths, basically 50 micrograms, and then we have some other strengths also. This is by Schering-Plough. Pegantron 500. This is basically peg interferon alpha 2B. It's really important to note which type of interferon you're using, whether it's 2B, 2A, and there's some other types of interferons as well, like beta and gamma, but this one, which is used primarily to combat hepatitis C, is interferon alpha, and this is again the pegylated form, which means that this is kind of a newer technology which combines or conjugates the pegylated moiety to interferon, and that way it's given just once a week, and not more than once a week as you would do with conventional interferons. Okay, so this is a red box. These are all 50 micrograms per 0.5 ml. It's reconstituted prior to administration, so it has the still water as well as the dry powder inside it. This is the 80 micrograms per 0.5 ml. So the top corner is colored green. So inside these boxes are all 50 micrograms, and then we have some pink boxes which are 120 micrograms per 0.5 ml Pegantron, and then there are some other strengths as well, but they're out of stock right now, so I'll just show them to you in some other time. What's this? This is Rofilac. This is a human anti-D immunoglobulin given to Rh negative mothers, who have babies who are Rh positive, and that's just to make sure that the woman is not sensitized to the blood of the fetus. Just to make sure that the mother does not go into a state of shock. So that helps neutralize antibodies which the mother has made in response to the blood of the fetus. Now the lower shelf, Erythrogen is again a form of EPO, Erythropoietin, 2000 international units. So most physicians start from 2000, but patients may get high doses, doses as high as 4000, 6000 and stuff. So it contains 6 vials. Then we have Hyaluronic. This is hyaluronic acid, which is given into the joint of patients who have rheumatoid arthritis, but this is confined for use in big joints only, for example the knee joint, and that is kind of material which increases viscosity of the synovial fluid and helps relieve symptoms of osteoarthritis. So Hyaluronic. Then we have Lectrum. It's used for hormonal upsets in men, and it has many uses. Leuprorelin acetate. So Erythrogen I've showed. Then we have Epokine. And this is again a form of EPO, recombinant human erythropoietin for IV or subcutaneous use, and it contains 2000 units per syringe, and this comes in the form of 6 pre-filled syringes. Then we have some low molecular weight heparins placed here. This is enoxaparin, and the very famous brand Clexane, enoxaparin sodium. It again has many uses, 6,000 international units in 0.6 ml, and one box contains 2 pre-filled syringes. So the blue box has a different strength. This is 4,000 units, and then we have another one which is 2,000 units. And since we are out, because it all depends on the prescription pattern and the demand we receive, so most physicians do not want patients to be started on the lower dose. So this is what we have in the pharmacy. Now here we have some albumin preparations. Albumin is mostly prescribed in patients with hepatic failure because the liver is no longer making albumin, and they lose the solid component of blood, and they may get edema and stuff. So this is albumin, human albumin, and it is basically straw color. And again, it's one of the very expensive drugs of the pharmacy. This is how it looks like, human albumin. It looks like some urine or beer. It's kind of foamy because of all the surfactants they've put in. Human albumin, this is 20%. It's a single dose vial, and the brand basically is Plasbumin, and this is by Grifols Therapeutics. It's made in the United States. It's a 100 ml vial containing 20% human albumin, and it conforms to USP specifications. And this little thing, this little baby is used to hang the infusion bottle, and it's sealed. Then we have some other preparations. This is again the similar one, and but by comparison you can tell that the box is a small one, so it's half the volume, 50 milliliters, whereas this one is 100 milliliters. The brand is the same, Plasbumin 20. 20 stands for denotes 20%, and the brand is Plasbumin. Then this is again by Grifols. This is 20 grams per 100 ml, and this is again human albumin 20%. I don't really know what's the difference between this preparation and the ones I've placed here, because this is also 100 ml albumin suspension, and it's by Grifols again, or Grifols, I don't know how do you pronounce this, but I'll let you know. It's sealed, so I won't be able to open this one, because patients are instructed to accept these products if they are received in a form which is intact. Some more. And then we have this one. This is low salt. Well, this is a different form of a human albumin, and I'll see prescriptions whereby physicians specifically state that the albumin should be low in content of the sodium it contains. It's a 100 ml vial containing 20% human albumin, and this is low sodium albumin, low salt albumin. It's a 20% suspension. And this is pretty much it. These I've shown, and again we have some more. Well, this is a smaller version of this type of albumin. It contains 50 milliliters, 10 grams per 50 ml. Let me just take my hand off. Yeah. 10 grams per 50 ml, and this contains 20 grams per 100 ml. Human albumin 20%. these are all the albumins we have here. Now let's move on to some antibiotics. This is meropenem. It's a very famous brand by AstraZeneca. Meropenem. It comes in two forms: the 1 gram vial and the 500 milligram vial. You know, this little powder, you know, it's kind of like maybe 1 or 2 at the max pinches of salt, and it's very expensive. This is more than 1k, 1000 rupees straight for the single vial, and it's for single use only. And most patients receive like up to 3 vials per day, so you know, you can just estimate the economical burden that places on the patients. And thanks to all the resistant bugs we have here, that now we've come to using such a broad spectrum antibiotic. So this is meropenem, the 500 milligram dose, and then we have the bigger one. This one has blue caps and this one has maroon caps, and it obviously looks bigger. And this is the lyophilized powder inside. Meropenem 1 gram. Here we have some more EPO. This is Hormone Erythropoietin beta. This is again a very famous brand, and it comes in the form of pre-filled syringes, 5,000 international units in 0.3 ml. So all these boxes are Hormone of the same strength, 5,000 international units, Erythropoietin beta. Here in the door we have tegacycline. It's a very famous antibiotic, pretty broad spectrum, 500 milligrams, and this is also in the form of a lyophilized powder. It just looks like orange tan, you know. I showed you amphotericin B also, which is colored yellow, and this is orange. Tegacycline. Then we have HMG-mesone. This is again human menopausal gonadotropin, USP, used for women, and this is 75 international units in one syringe. Some HMG-mesone here. Then we have, here we have Hep B. This is Hepatitis B immunoglobulin used in infants, in babies maybe, who are suffering from an infection, an active infection with this virus, for neonatal use only, for intramuscular injection. So these are all the hyper-Hep preparations we have here. Then we have Prostaglandin E2. This is again a very famous drug used to induce labor in women. It comes in the form of 3 milligram tablets. This is again a very expensive drug, 4 vaginal tablets. And this big box contains small boxes inside, which we dispense on the prescription of the practitioner. There it is. Prostaglandin E2, 1 vaginal tablet, 3 milligrams each. This is by Pfizer, and this drug has been short on the market for quite some time, and now it's come here. You know, we are seeing so many prescriptions of this drug from the gynae ward. Moving ahead, here we have some eye drops. This is Cystane. It's a lubricant made by Alcon. Alcon, a very famous maker of eye products. Cystane. Then we have Travaton or Travatan. This is Travoprost, 40 micrograms. And what's this? This is Minogon. This is active minotropin. here. For intramuscular subcutaneous use, and each ampule contains minotropin, and what's the strength? 75 international units of follicle stimulating hormone and 75 international units of the luteinizing hormone. And it does mention some other inactive substances as well in case some patients are allergic to one product. This is again Presage, I've shown you this before. And then what's this? This is Progefic or Progefic, Progesterone for vaginal use. 200 milligrams. And then we have Lumexin. This is an antifungal, fenticonazole nitrate. These are vaginal ovules, and it contains 2 ovules in all, and the strength is 1 gram or 1000 milligrams. Lumexin T. This is again Minopon, and this is Filgin. This is basically filgrastim, the granulocyte colony stimulating factor, and this is again common in patients who receive chemo and they just want to bring their WBC level up to the normal, within the normal range, and then they prescribe Filgin, filgrastim. This is 30 MIU, 30 million international units, and it just contains 1 vial. And this is the top row. This is the carbazine, a very famous anti-cancer drug. Darbazine. It's 5 EUs, and this is 200 milligrams. Then right next to this we have Declare ST. Declare is again streptokinase, the drug which is used to break clots down in patients who've undergone some kind of who've just had a heart attack, and the patient cannot get a stent immediately, so they use this streptokinase. It's again a very famous drug, and it contains how many international units? 5, and I don't know, it's like 100,000 international units. Declare ST. It costs 5,000 rupees almost for this little thing. And it has this little protection, this foam to protect the box, because obviously we do not want the drug or the ampule or the glass bottle to break during shipment, and it's again in the form of a lyophilized tablet. And it's a high protocol drug, because we exercise extreme caution when this has been given to the patient. And again, it has it has a long list of contraindications such as active bleeding ulcers and history of stroke, or arteriovenous malformations, AVMs, and all stuff. This is interleukin 1, Thrombovax, interleukin 11, recombinant human interleukin 1, and then we have Pregnil. I've shown this before. This is again human HCG, 5,000 international units. So now what remains is the top shelf of my fridge. We have Zometa. This is zoledronic acid, 4 milligrams in this box. The powder and the solvent. Then Electrum I've shown. I don't know why all these pharmacy technicians place one thing at more than one place in the fridge. Andrex, this is testosterone, 30 capsules. Then again this is Goserelin, Zoladex, used for fibroids, 3.6 milligrams. Given subcutaneous, this is again pretty expensive. And then we have another form of PEG interferon alpha 2A. This is 2A recombinant, 180 micrograms per ml, because this is what most physicians start the patients on, 180 micrograms. This is again a local brand, a Pakistani brand, Hilton. Most physicians try to prescribe interferon by a very famous pharmaceutical company, Pegintron by Schering-Plough or some other brands. But when it comes to making choice for a patient who has affordability issues, we might want to come to a brand which is less expensive. So this is pretty much it. This is the second fridge. Here we have the temperature sheets pasted onto the fridge, and if I just show you the here we place ice, because there are products which need to be maintained at a certain temperature. For such prescriptions we provide ice with them. For longer distances we have these little ice packs, and for others we use this. So this is pretty much it. I've shown you all the drugs we place here in the pharmacy. This was the first fridge, that was the second one, and I might do a video in which I'll take you inside the cool box and show what do we have there. So thanks.